Most seniors would prefer to keep living at home as long as they can. And even if they need a little help with daily tasks or maybe some temporary medical care after a health event, that doesn't mean they're destined for a senior living community. Home care and home health care are two different options that can provide the support seniors need to remain independent and at home. However, there are some distinct differences between these two care types that you need to know in order to determine which is the best fit. By the end of today's video, you'll understand what sets home care and home health care apart from each other. I'll also share our care assessment tool, which will actually recommend a senior living type based on the answers you provide. Let's get started. I'm Grace with A Place for Mom. If you haven't met me in any of our other videos, you can find those on our channel. I help create articles, tools, and other resources that seniors and their families can use to identify care options that fit their needs. While both home care and home health care may work for someone who's able to live independently at home, there are some major differences. The first and biggest difference between home care and home health care is the type of services they provide. Home care provides non-medical services, while home health care, as you may have guessed, focuses on medical needs. Home care provides support for seniors with activities of daily living, sometimes called ADLs. These are basic personal tasks such as bathing or dressing, which can become challenging as someone ages. Struggling with these tasks is one of the main signs that a parent needs help, which I just talked about in our recent video. For someone who needs help getting in and out of bed, getting dressed, making meals, or going to the bathroom, standard home care could be a great option. Home care can also help with instrumental activities of daily living, or IADLs. These are more complex than ADLs and can become overwhelming for a senior who lives on their own. IADLs include things like managing finances, scheduling social activities or medical appointments, light housekeeping, and transportation. On the other hand, home health care is typically prescribed by a doctor and will often be ordered for seniors who are transitioning home after a stay in a hospital or rehabilitation facility. For example, a senior who's recovering from a surgery may no longer require around-the-clock care, but would benefit from regular check-ins. A visit from a home health nurse may include monitoring of vital signs, wound care for incisions, or detailed care instructions for the senior and their family. Home health care can also provide rehabilitation services for individuals recovering from a medical event, such as a stroke. Because home health care focuses on medical care, while home care focuses on assistance with ADLs and companionship, caregivers for each option have different qualifications. Home health care employs medical professionals, such as a registered nurse or a licensed practical nurse, and these individuals have been trained and licensed to provide medical care or rehabilitation services. With standard non-medical home care, providers typically train staff in caregiving duties, and these caregivers are called personal care aides. Another difference between home care and home health care is cost. Care services are typically more expensive in areas that have a high cost of living, and costs can also be higher in states that have stricter requirements for care aide training. And regardless of whether you're looking for care at home or in a community setting, the more specialized the staff or services get, the more it will cost. That's actually why skilled nursing facilities, which are similar to nursing homes, are the most expensive senior care option. Skilled nursing provides the highest level of medical care available outside a hospital setting. In the same way, home health care is more expensive than standard home care because home healthcare providers and services are more specialized. While both options are typically charged hourly, the national median for home care is about $30 per hour, according to A Place for Mom's annual report. A home health aide was about $33 per hour in 2023, according to Genworth. That actually leads us into another big difference between these two care options, and that's your options for covering costs. Because home health care is usually prescribed by a doctor and includes medical care, Medicare, Medicaid, and private health insurance plans will usually cover at least some of these costs if certain eligibility criteria are met. When it comes to paying for non-medical home care, families typically use private pay options like their personal savings or long-term care insurance. If you're interested in understanding all of your options for covering care costs, check the description for a link to our video on ways families typically pay for care. Okay, so we've talked about how home care and home health care are different, but now I want to cover some of the ways they're actually similar. Before I do, please like this video and subscribe to our channel. And don't forget to check out the description for more information on the differences between home care and home health care. You can also use our free care quiz, also linked in the description, to help determine which senior living option would be the best fit for your specific situation. Both home care and home health care offer a lot of flexibility and allow someone to age in place for as long as possible. The client can hire the provider for specific days and services, and they can even add hours or services as they need them. For example, if you have an older parent who only needs help for part of the week, whether that's for meal preparation or IV therapy, both options give you the ability to sign on for the days and times that work best for your family. And while most families hire a home care or home health caregiver through an agency, you actually can hire private caregivers for either option, though I highly recommend looking at the pros and cons of that route to make sure it's the best fit. Agencies have their own standards, procedures, and requirements to make sure you can trust the person coming into your home to provide assistance. Whereas hiring a private caregiver yourself means you will need to take on that responsibility. Okay, those are the major differences and similarities between home care and home health care. I hope you found this video helpful. If you have any questions or want to share your own advice with other caregivers, drop those in the comments section. If you'd like to learn more about senior living options, we'll have some helpful content linked in the description. And for more advice on caregiving, senior care, and more, you can visit our website at aplaceformom.com. Thanks for watching.